real life music.
Assalamu alaikum. Good morning, Gambia. Good morning to the other side of the world. Good afternoon to the other side of the world. And good evening to the other side of the world. Welcome back to your favorite online talk show, A Cup of Tea Sikirge Akadija. And today's episode is going to be very important because with me here today we have health workers on this platform today to discuss on a very important topic. And today our topic of discussion is maternal death, and it is very rampant in the Gambia nowadays. So I think it's very important to talk about that. And today here we have the health workers here, and I will let them to introduce themselves before we start the program. Welcome to the platform.
All right, good morning. So good to have me here back again. I am Lamin Banja. Thank you very much.
Thank you so much. And to you?
Yeah, thank you very much. Good morning. My name is Ibrahim H. Bande. Thank you for having me here.
You're all welcome. So we will take a short break before we start the program. Thank you so much.
It's real life music.
Welcome back, viewers. So as I said before, today our topic of discussion is going to be very important because it's maternal death. In the Gambia nowadays it's very rampant, and I think we should talk about it. But then before we go further, hence I don't know much, so I will let Nami to do a little definition of maternal death before we go further. Nami.
Okay, thank you very much. Okay, maternal death, like the saying goes, though the word maternal could be new to some other people, like some viewers, but in short, maternal death simply means women that that die during childbirth. That is the simple definition. That is the simple for the benefit of those who are not health oriented or who are not very experienced or who are not well known into the health system. So maternal death could simply mean like when women die during childbirth. So that's the simple definition. Yeah.
Thank you so much, Namin, for that definition. So Ibrahim, can you just tell us a little thing you know about the maternal death?
Well, I think my colleague here has summarized everything. Maternal death, like you said, is becoming rampant in this country, and it's becoming very alarming. So it's very important to discuss it in platforms like this. So, like he said, even the WHO defined it this way. He said it's a death of a woman while in pregnancy or during childbirth. That is maternal death.
Thank you so much, Ibrahim. It's well said and very clear. So to move on to the other question is, what are the causes of this maternal death?
Okay, very well. The causes of maternal death are very numerous. We have so many different causes that we cannot overemphasize on all of them. But we will talk about some, and then hopefully if we have other platforms, and then we can talk about more. So the first important thing is the main cause of maternal death. The most important thing is the time that you get married, or the time that we make our fellow female to get married. It's very important. It has a role to play in
the
time. Because obviously, for example, what I mean here is that, for example, you take a young child and then of 14, 15, and then force her into marriage. Let's say a child marriage is also something that that could lead to maternal death. Because let's say, for example, a child of 14 or 15 years old and then is forced into marriage, and then apparently the child conceives, and then what do you expect that child? Because we all know, as when someone gets pregnant, there are so many changes and so many developments that take place as far as health is concerned. So you will realize that during that time, children, most women at that stage when they conceive, the risk of surviving that pregnancy is very low. You understand? So that is also one thing. The other thing also is our diet. You understand? Because diet also is very important. Like when a woman is pregnant, you expect the woman to be taking blood supplements all the time. So when the woman suffers from anemia all the time, the woman suffers from anemia is also another factor. You understand? So the other type also, or the other thing that could also trigger the rate of maternal mortality also is, labor. Let's say the way labor is being conducted. You understand? Because most of these people, when I say labor, I don't mean work. I mean during birth, exactly when they're given birth. During the labor period. Most people let's say ignorant about the issue, you understand, because most of the times we have some people that we call the traditional birth attendants. So those traditional birth attendants, usually they don't have much knowledge about in helping women that is delivering, you understand. So when a woman started labor, at least you should try to consult the hospital or take the woman to the hospital as early as possible. But most people will say the hospital, we have to go to the hospital late. We don't have to go to the hospital early, because if you go early, they're going to operate the woman, you understand. So apparently before you reach at the hospital, so many things could happen on the way. So these are some of the few things. There are a lot of things that can definitely cause it, but these are just some of the few things that are common, especially in our country. I forgot one more thing is that people forget one thing, like the early bookings at the antenatal clinic. This is very, very important. You will see a woman who is pregnant like for 6 or 7 months and never visited a health center. You understand? So that is a problem. And then since from the first trimester of your pregnancy, or from the first month of your pregnancy, you are expected to go to the hospital and then take some supplements that are given to the pregnant mothers. You understand? Things at that time, up to 36 to 37 weeks of pregnancy or gestation. So someone who doesn't go to the hospital from all those times, you understand, and then you are expected to deliver normal delivery while you don't go to the hospital, it's also going to be a crime. You understand? So this is something that is affecting us in our society. You understand? But I believe we will reach to that point when we reach at the some of the things that, or some of the roles and responsibilities of nurses or parents. We will reach to that point, I believe. So those are a few things.
So you mentioned one of the causes, like the diet or the type of food they eat. So what do you mean by that? Can you break it down?
Okay, diet is very, very important as far as our health is concerned. Like one of the saying goes, you are what you eat. For example, that saying, it simply means anything that you eat has to benefit you, understand, in your diet that you take. So as far as pregnant women are concerned, they are expected to eat certain diets that we, or other people who are not pregnant are eating, you understand. Everybody has the right to eat a balanced diet, of course, but a pregnant woman should eat more balanced diet, because you are expecting the fetus, that is the baby, to also get all the nutrients that it needs from you, you understand. So in that you need so many things from the food that you eat. So you should make sure you eat a balanced diet. And then that balanced diet, you can have it in foods like the fats and oil, the carbohydrates, the proteins. You understand? You need to increase the intake of all those things as far as the pregnancy is concerned. You understand? Because of the baby also, like I said, the baby also is trying to get some of the things from you. So obviously, if the mother is malnourished during pregnancy, you don't expect the child to also have something. Apparently, the woman, you need energy during labor to be able to expel the fetus, to be able to deliver. So if you don't have that energy, you are malnourished, you don't have the energy to push the baby out, so many complications could come. You understand? Okay. Yeah.
Alright, thank you so much, Lami. So Ibrahim, I would like you to emphasize on the third cause, which is like the traditional practice of women when they are in labor. What do you have to say on that?
Thank you, Khadija. Well, the traditional practice when it comes to, in regards to labor, like my colleague mentioned earlier, like this, they have traditional birth attendants who, they believe, in fact, more than even the healthcare professionals.
Yeah.
And not all labors are normal. There are certain labors they are not normal. So they need an intervention in the facilities. So now, in that being the case, you see these traditional labor attendants struggling. Some cannot come out absolutely all. They cannot even see very well. They are struggling to see, to deliver somebody. That is very serious. That is also contributing to maternal mortality. Before they realize that they cannot do anything about it, the person has already lost a lot of blood, and the person will eventually die. Because most of the time, that's the main cause of maternal death is losing blood. Severe blood loss can lead to maternal death. Yeah.
Thank you, Ibrahim. So do you have another causes
Yeah.
added to what
Among the
said?
causes, I think among the causes, because if you look at the statistic also, they will tell you that the high rate of maternal death occurs in developing countries.
Okay.
In developing countries, meaning I cannot say lack of facilities, but we have insufficient facilities. I'll give you an example. Like a woman is in labor, located in an area where you know that there is no good road system, or there are no facilities available like ambulance to take the woman immediately to a nearby facility to be delivered there. So in that case, also struggling to go to the hospital, if you don't reach as early as possible, the person can die along the way. That is also another cause of maternal death. So, there are many, like I said, there are multiple. One of it could be also unwanted pregnancies. Some families, they try to hide their kids because they believe it is a shame when their girl child is pregnant, and then they want to restrict the child in one place until the child is due for labor.
Yeah.
And they will not even bother to take the child to the hospital because of they believe it's a shame. Not many people should know that. That one also is a cause.
Thank you so much, Ibrahim. So, pour ma gën leen ko leeral tey suñu waxtaan bi moo nekk maternal death. Soo déggee ñu ne maternal death mooy comme jigéen bi nga xamante ne mu ngi toll si am doom wala ko xam ne dafa ëmb ba pare toll si am doom. Ñi nga xamante ne tey ñii la invite ay health workers leen si maanaam si ay hospital la ñoo liggéey ñoom tey dama leen invite tey ñu toog fii waxtaane li nga xamante mooy maternal death. Te gis nañ ne for the past month lii nii xew na si Gambia bi fii nii suñu jigéen yu bëri ñu ngi ñàkk seen bakkan si suñuy am doom te loo xamante ne jigéen ñoom ñooy jur suñu doom yi nga xamante ne ñooy yor ëllëg aduna bi fii nii wala si réew mi ñoom ñoo koy yor suba nekk na loo xamante ne lu daw yaram la moo tax tey ñu ne il faut ñu indi this topic tey ñu waxtaane si pour gën na naa faram-fàcce si li nga xamante ne mooy luy waral suñ jigéen ñi di ñàkk seen bakkan si bu ñuy am doom mooy lu ko waral mooy yeneen yi mu ne comme ni ko Lamine waxee mu ne first one moo nekk nit ko xamante ne xale la mu ngi am ay 14 years wala 15 years nit ko xam na du mut pour mu mën a am doom wala mën a wasinal boppam loolu tam dina ko dina def ba nit ki war a ñàkk bakkanam si loolu another one bu mu wax mooy nit ki boo fekkee da nga ëmba ak lekk yu ngay lekk tamit nekk na important tamit pour jigéen bu ëmba nga contrôle bi nga xamante loolu nga war a lekk and the third one bu mu wax mooy tamit ñeneen ñi dañ gëm li nga xamante ne mooy culture wala tradition ñu koy waxee su nekkee jigéen bi dafa ëmba dañoo wane ne jarul ngay teel a dem si hospital bi because of yaa ngi go through labor jaral na leen ñu toog ñu téye la foofu noonu ba am time bi des tuuti fekkee yow soona nga sax si biir sa kër balaa ñu laa yóbbu si hospital bi war na dina tax ba nit ki balaa muy àgg si hospital bi dina ñàkk a bakkanam wala su àggee si hospital du mën a def dara parce que dooleem yëpp dina dem si yoon bi li nga xamante ne Ibrahima tamit wax na ko mooy ñi nga xamante dañ dëkka si village bi ñi nga xamante ne amuñ yoon yu correct balaa ñuy àgg si hospital yu mag yi dina ñàkk seen bakkan si yoon loolu yëpp cause of maternal death la and jërë ngeen jëf si that for clearing that question. So the other one that I have to is that can you tell us the brief statistic of this maternal death? Just a brief of it.
Okay. Actually, the brief statistics of this maternal death, we've realized that like the percentages are going to be a little bit confusing as far as data is concerned. But in the Gambia, we realized that from 2017, because there has been a drastic reduction in the number since like 2000 to 2004, coming down to 2007. But we realized that from 2007 up to date, and up to 2019, it has increased to like let's say it has increased to like 2.7%. You understand? From 2017 up to 2019. You understand? So we expect it to drop, but it is increasing. You understand? Because there has been some years where we will have like less than, let's say, less than 5 deaths in a year. Understand? But only this year we have more than 10. I can say, understand? Especially the last 2 months, we have a lot of maternal deaths. You understand? But I believe so many factors could be responsible. You understand? So that is why, like I said, bookings at the like we said previously, bookings at the antenatal clinics are very, very important. So the statistics definitely is not showing well. You understand? Because we've seen a recent, because the latest statistics is not yet out, because they keep on updating, like every year they will update. But like from 2017 to 2020, there has been a mass increment, because 2% increment is something. You understand? If I am right, 2% increment, because the world is trying to fight for like 0% maternal death. You understand? So if we are still recording, it is alarming. You understand? So we are countries that are increasing in the rate of maternal death. Other countries, they have 0, so we will have 1, so we will have 2. So it is alarming that we are increasing, especially this past months.
Yeah.
You understand? So that is it.
Thank you so much, Lamin. And I want to thank King Ahmed Ceremony job opportunity people use this venue, and then the resident is called Baba's resident. Because thank you so much for giving us this opportunity. And they were here because Ahmed Buga plan to come to Gambia, and there is this beautiful resident in Kololi, just on the highway, so you can check it out. And inshallah, I will display the video of the resident, the whole resident, and then you will see it for yourself. Well, let's take a break, and then we'll be right back. Thank you so much.
Golden beat on the track. Golden beat on the track. Golden beat on the track.
Welcome back, viewers. So let's get to the other section, which is Ibrahim. Can you mention what are the risk factors of maternal death?
Okay, thank you, Khadija. Thank you very much. These risk factors, just like the causes, these factors are just like almost similar to the
Causes.
That is the things that cause an individual to be exposed in this maternal death. Like we mentioned, one of them is that is lack of good road network.
Okay.
Like if you are to transport a patient in labor and then the road is not good, that is going to cause the person to a maternal death.
Okay.
Because that is one factor. Another factor could be also lack of good quality services. Maybe because we have health workers that are specialized in delivery. Like if you give it to the person who is not well skilled, he is not trained on that, that could be also a factor of maternal death. Lack of maybe not registering early, not going and registering at the prenatal stations. That is going to be risk factor, or you have a high risk of dying when you are delivering.
Okay.
Again, the diet is very important. If you are pregnant, you are expected to eat good food, have a good diet that contains all the ingredients needed for the person to be able to sustain the pregnancy. But if you are not doing that also, if you are not eating fine, you are not expected to make it life in labor. Yeah.
Thank you so much. Because I believe so, when a pregnant woman is, having who is pregnant is like a sick person too, because that person is not having a full health within herself. So, Lamin, can you also tell us, because the main concept of this program is to talk about topics that concerns the society, and I believe the society too, or the community, they have an important role to play.
Yeah.
Right. So I want you to just tell us what are the roles of the community to prevent the maternal death.
Okay, the community, first and foremost, the community should have only one thing in mind. That is, they have to have something in mind that says no woman should die while giving birth. If that concept is clear to everybody in the community, then our sisters and our mothers will be safe. You understand? So from there, the community has a very, very, very big responsibility to carry out. Understand? Because the other responsibility is the community should be ready to listen to health workers. You understand? Because listening to health workers is also something very key. There has to be that trust between the community and then the health workers, and then the community should know that should be, and that is a responsibility of the health worker. But we will come to that. But the community should also be able to, respect and then promote all the teachings that the health workers are giving to them. You understand? So when that happens, you realize that the rate of maternal death will be very, very reduced. You understand? And then the community should also encourage the woman. You understand? It's not that pregnant women should only be protected at the hospital, or should only be, let's say, should only receive like medical advices at the hospital. No. We are in the community, we have some various people who have experienced childbirth, you understand, and then they know some of the things. Their advices are important, so they would likewise talk to the patients or to the mothers, and then teach them, explain to them how to carry the pregnancy, and help them in some of the works that they do at home. Some people in the community will tell you, if you are pregnant, you need to do very, very heavy work. If not, if you are giving birth, the labor will be very, very difficult. That is a fake statement.
Yeah, that's the perspective that they have.
Yeah, that's the perspective they have.
But based on the traditional, culture of our people. Before, that's how our mothers used to think. Like when you are pregnant, you have to do heavy work, or when you are pregnant, you have to be active all the time, so that it can help you when you're delivering.
Yeah, you have to be active. 100%, like we all agree to that. But there's something that needs to make you active. You understand? You cannot just tell someone, a pregnant woman, you should work, and then for that person to work, she needs energy. So the first thing that we should talk about is the food that you eat. the patient or the mother needs to eat a balanced diet in order for her to get energy to be able to do her extracurricular activities at home, so that she will not relax. But someone who is not eating very well, you expect that one to walk, and then you are always on her neck to walk so that the labor will be easy. That labor cannot be easy, because that before she will give birth, she might end up losing all the energy that she needs. And then, they need, as pregnant women, they need energy, like I mentioned. So that is also something that the community needs to focus on. They are numerous, there are many. The roles of community is very, very many, but these are some of the few that we need to talk about as far as our time is concerned.
So Ibrahim, do you have anything to add to that?
Yeah, Khadija, I think that role is very important. Like you said, the role of each and every one of us has a role to play to prevent this maternal mortality. Like we are talking about the community, there are multiple roles, but one of the roles the community can do also is like they have VDC, they have groups. They should be sensitizing each other about the importance of this RCH, that is these mothers, these pregnant mothers visiting the RCH for their checkups. That is very important. They should also, like a husband, you have a wife, you should also be caring enough. You should be caring for your wife. But you start at home. Prevention is better than treatment. That's what we always say. So before you take your wife and they tell you your wife needs blood or your wife needs this medicine, why don't you buy your wife good food, your pregnant wife good food that when she take, it will not reach up to that extent of blood transfusion and eventually death. Yeah.
Alright, thank you so much, Ibrahim. So we get to the last point, which is what is the role of the health workers in the prevention of this maternal death?
I think this is the most important point. And at this point, we need to dwell more into this point. As far as maternal death is concerned in the Gambia, the trust that people have in health workers, it is very, very sad. People don't trust health workers anymore. And this is making sure that the rate of maternal death will increase. Because if you don't trust a health worker, you will not go for your bookings. You will not go, like they said, you will not go to for your antenatal clinics. You understand? So that is a problem. You don't go to antenatal clinics, you can develop something that they call the eclampsia or the pre-eclampsia. All those things are there. Or the PIH, pregnancy-induced hypertension. So all those things are things that you can develop. And then if you develop those things, your blood pressure always shoots. Your blood pressure is always high. You understand? If you are not careful, you might eventually die. You understand? When given birth, because actually you are not registered. It is not captured on your antenatal card that you are you are a patient with high blood pressure. Because usually it is indicated there on top of your maternal paper. You understand? But if you don't have the trust to go to the hospital, they will not have the trust, or they will not be able to take your blood pressure and monitor you and know that you are hypertensive, or you are this and this and that, or you have this condition. You understand? So it is going to be a problem. So health workers, as far as we are concerned, we have a very, very diverse role and responsibility to play in this role. I think we have the most important role. Even the community, patients are always right as far as health is concerned. So if we want to make sure they trust us, we have to go out and then talk to them, make sure they trust us. There is something that we call ethics. From your first year at the nursing career or at the medical field, you understand, there is the ethics of your work. It's been introduced to you, and you know how you should work. So some will tell you, you go to the hospital and this nurse is telling me, or this doctor, this nurse is telling me, when you were doing it, we were not there. So you have to, those things, those are not ethics, you understand? And then I want to put it clear to people that this is not something that nurses are taught at the schools, you understand? If anyone has it as a habit, it is very, very sad that our fellow health workers are doing it to our own sisters and then our own brothers. Like we say, no woman should die while giving birth. So we should treat them, even if they never go. I'm not saying they should not go for antenatal clinics, but patients are always right. You cannot punish someone for not coming to an antenatal clinic. You understand? So we have a very, very important role. You understand? Even if they are pregnant, we need to talk to them, counsel them. You understand? All those things are our responsibility. In fact, meet them in their communities. Talk to them about how things are done. Talk to them about how to carry a pregnancy. You understand? But we just leave them and then we don't talk to them. We say when they come to hospital, fine. When they don't come to hospital, let them remain at home. This is something that is affecting us. You understand? So I believe our authorities, because we are just small people in the ministry, but our authorities, but some of them might be able to look at it and then they will know definitely what we, and they are also trying their very best, because we know that what we are taught at the school is not to maltreat patients in the hospital. You understand? And definitely when patients, because one person cannot say this so and so nurse did do this to me and then or did this to me and then the rest of the nurses are denying it. Because many people will be saying it in the streets, not only one, not twice, even before we become a health worker, you realize it has been happening and it is still happening. You understand? But that doesn't mean it is something that is right for people to do. It is not right for people to do. You understand? We should not do it. We should not maltreat our patients. We should make sure patients believe in the hospitals. We should make sure they trust the hospitals. They come to the hospital for their bookings and have safe deliveries and then go home. That is what. Those are few of the responsibilities of health workers. Let's say, because it's not only nurses that are health workers. We have so many different people in the hospitals. You understand? But people confuse nurses to doctors, to orderlies, to nurse assistants, and all those things. There are so many different things. You understand? But when you come to the setting of the hospitals, whenever a layman come to the hospital, sometimes even at the door or at the gate, they will start calling securities nurse. You understand? So everybody is a nurse in the hospital settings.
That is,
you understand?
a stereotype that they have.
Yeah. You understand? So that is what people have in mind. So that's why anything that happens in the hospital or any bad thing, they will say that nurse did so and so to me. You understand? It's something that is affecting everybody. You understand? So, but we have a role to play as a health worker, and then if we are unable to take care of our patients, I think our authorities have the right to come on board. We have our ministers, we have so many people that are superior to us, and then definitely our teachers are doing great, because the first thing that they teach you is ethics in your work. So if you are telling patients, it is your fault, it is something, because somebody who is on the verge of dying while in labor, you understand, it is something, it is going to be very, very difficult for that person, for you to be shouting on that person that the person did not go for antenatal clinics. You understand? So this is something that we need to think about.
As you said, because maybe there are many reasons why that person is not coming or visiting to the hospital early when the person was pregnant. So, Ibrahima, can you also tell us how are you guys taking these blames all the time from this patient, and they are saying that the nurses don't know how to do their work, or nurses don't know how to treat a pregnant woman? How are you guys taking this?
Well, actually, recently that is the talk of the town.
Yeah.
You are right about that. Well, I will just go on and hit the nail on the head. Well, don't think that also I am being biased. There are good nurses, Khadija. But just like the saying goes, one rotten potato spoil the whole bag. So that is the problem here. But indeed, despite the fact that we are trying, there is still room for improvement. Health education is a key role that the nurses, we as nurses, must play. Why? Because most of these trainers are very young. They know nothing about pregnancy, and at home they are not also given adequate information in order to how to go about their pregnancies. So the right platform where they should be fully informed about the pregnancy, where pregnancy progresses, is at the hospitals or in health centers. And we are the right people to support them. But it is rather unfortunate that we know, but some nurses telling you, it will interest you to know that they discriminate these young teenagers. Eliminate our mothers, because every woman is a woman. So, Khadija, take for example, the moment I come for you for help, I open up to you, I tell you all my secrets, then you discriminate me. Did you expect me to come back again? No. So that is a point. As nurses, we should improve on that. We shouldn't discriminate our patients. We should have a strong bond between the patients and the healthcare worker. Yeah, because if you do that, any progress, anything that is wrong with the mother, you inform this is what is happening to you. They will keep you fully updated as to how their pregnancy is progressing. But the moment you discriminate them, they will not come back again. So that is a key role as nurses that we should play.
Thank you so much, Ibrahim. So this brings us to the end of the program. But then, as you are the health workers, so what are your advices to the patients out there and to the public out there too?
And I think our last week, this is a general responsibility. We, as health workers, we have a role to play, and the community has a role to play. The government has a role to play too. So even the person that is the victim, that is our mother, they also have a role to play. So what I want to tell them is that the moment you are pregnant as a young mother, whether you are a young mother or not, you should go for antenatal checkups. That is very important. And again, I will not forget my fellow men. You should be very caring for a pregnant. It is good to have a baby, but the processes involved are very critical. So if you don't want anything wrong, anything to go wrong with your wife, you need to give them the maximum care they need in order to put it to bed without any death. So thank you very much.
Thank you so much, Ibrahim Abalde. Namin, you too.
Okay. Just to wrap up, I would love to thank you, and then for inviting us to this platform. And then the other thing I would love to talk about as my closing remarks is, like he mentioned, men, us the men. It is very, very rather unfortunate that you keep a woman pregnant, and then that's all. The only thing that you can do is maybe to give the woman feast money and all, but you don't bother to ask the woman about her antenatal checkups and all those things. Like he said, maternal death most commonly it hits developing countries. So in that case, you expect men to be going out for struggling, you understand, and then leave women at home. But even if you cannot go with the woman at the hospital, but you need to be following up the woman time to time to confirm, if the woman is going for antenatal checkups, you understand. And then you cannot tell me, for nine good months, you don't have even a single time that you will go with her to the hospital and then try to find out most of the things. So we have a key role to play into this as far as our maternal death is concerned, because obviously a woman who is delivering, let's put it like this, that woman obviously needs blood, and then when the woman needs blood, the first person we need to consult is the hospital. You understand? So it's very, very sad that you go to the hospital sometimes, they will tell you a woman needs blood, and then some of the patients will start saying, how to call it, like the Mandinkas, they say, for you know, a sanja, or you understand? So this is very, very difficult. Sometimes you cannot diagnose it. Blood cannot, you cannot buy blood, and then we also understand that, some patients will tell you, when we went to the hospital and then they sold us blood, you understand? I want people to understand that, blood is not sold in hospital, and anywhere, you cannot buy blood, no one can buy blood. Any health worker that tells you should buy this pint of blood, you should go to the authorities and then report the individual. They should take it to you, because blood is not something that we requisite from the ministry. The ministry, they can requisite, or the government can requisite drugs and all things, but blood you cannot requisite. You have to do it with blood, because you cannot manufacture blood. You understand? So that is why we have regular donors, and then we have some other donors. So obviously you cannot go and tell people to come and donate to you by force when your people are there, or when your husband is there. So health workers can do everything. They can sacrifice their life, but then they cannot provide blood that they don't have. You understand? I see some health workers, they have sacrificed, to donate their patients, lie down, and then they take private blood from them and give it to their patients. You understand? So this is something that we need to put in our mindset. So if you are pregnant, you lose a lot of blood, you understand, before even giving birth, because as you are getting, that's why they bought them on a drug called FIFA, a blood supplement. So, but all those things, you cannot have all those things if you are not going for antenatal checkups. And then men have key role to play in that antenatal checkup. So we have to be following our women, you understand, for them to have a safe delivery. The other thing also is that social media has disturbed a lot of people, you understand. A lot of confusion is going around the streets, you understand. People are making, you see some other people sitting out of the country or in other countries telling people, you don't trust your health system. You should not go to your health system, your hospitals, because if they want to politicize everything, you understand. And then that is not safe. I believe all our brothers and our sisters that are abroad should let us try to help our country, you understand, and then we develop the health facilities. If the government is not doing it, we cannot blame the government. We can only blame them that they are not doing something, but we cannot change the situation. Whosoever loses his or her life will never come back again. So the best thing is, if you have a single help that you want to make, come on, help, and then you are helping your country. You understand? You should not wait for the government, because the government, we all know how governments work. You understand? So if you want to do something, do it for yourself and for the benefit of your country and for your citizens, because the life you save might be your own life someday. You understand? So this is a few things that I have, and then thank you very much.
Yeah, thank you, Lamin, and thank you for making that thing clear that these bloods are not sale. So I myself, I don't know. That's why they say who knows better, right? So I myself, I never think of like this blood donation is for free or they are giving it for free. For me, I was thinking like the nurses used to sell it to people to use it.
Yeah.
So thank you so much, Alamin, and thank you so much, Ibrahim Abade, for coming on this platform today. And I hope the viewers out there really enjoy this episode today. And also, bëgg naa gërëm ki nga xamante ne tey moo nekk suñu caméraman bi di ko wax Ali di wax jërëjëf yow tamit sa liggéey rafet na parce que tey yaa ma fi nekkaloon si Cup of Tea si kër gi ak Khadija, and thank you so much dear, we really appreciate it. And please go to my YouTube channel and please subscribe there. Follow me on Instagram and Facebook too to get more updates on a Cup of Tea si kër gi ak Khadija. So see you guys next Saturday inshallah with another interesting topic. Thank you so much.